Oh, I'm good. Sure. Oh, I would have taken all the good stuff. Good to go. Okay, well, um, good afternoon, everyone. Uh, my name is Michael Ford, and I'm the City Councillor for North Etobicoke here in the City of Toronto. And it is my pleasure to welcome you all to the Mass Immunization Clinic at Woodbine Mall. I have a number of special guests, Dr. Davila, Chief Peg, Amita McThur, Wayne Drummond, President of HBC here, and of course, Mayor Tory, who is no stranger to our community. It's been 554 days since COVID hit Toronto. We have had our ups, our downs, our trials and tribulations. But it is with thanks to all the doctors, the nurses, our healthcare workers that we are getting through this. And I think today is another step in our journey to brighter and better days. So with that being said, I'd like to welcome Mayor Tory to the podium. Thank you.
Well, I'm taking my mask off slowly so you can all see this wonderful Hudson's Bay Company mask. And this is, of course, a logo that all Canadians are familiar with, and it's our greatest historic company in terms of how long it's been around and all the different contributions it's made over time. And here's one more contribution that they're making today. And so we're here to not only open the clinic and make people aware of its existence, but to say thank you to the Hudson's Bay Company for their civic mindedness in coming forward to partner with us to have this clinic. And I'm delighted to be here with Councillor Ford, and he has been helping us a lot at this part of the city, the sort of northwest part of the city, not through lack of any effort on the part of all of our healthcare partners and ourselves, has been challenging for us for a variety of reasons to make sure that we get the vaccination done, and earlier on with testing and things like that. But we've worked at it, and we've worked at it with great help from Councillor Ford and, of course, the great leadership of Dr. Davila and Chief Peg, who are both indispensable parts of how we've got to where we are. I had actually not, Councillor, been counting the days, but you tell us it's 544. Seems much longer, actually, but nonetheless, here we are. And we're here with Wayne Drummond as well from HBC. And I want to just welcome people, whether it's through the media or welcome this fabulous team of people here. And I went around and said thank you to as many people as I could, but I say for the people who may be watching this through the media, that the team of hundreds and hundreds and hundreds of people, nurses and other kinds of technicians, pharmacists, doctors, who have stood in there for us for months now, 554 days since the beginning of the pandemic, but also the vaccinations began in the spring, and just done a magnificent job. We are not at the stage where we have vaccinated more than 4 million doses into people's arms because of anything less than a stellar effort on the part of those people. And I thank them again for what they've done. And I'm sure that I'm extending those words of thanks on behalf of all of the people of the City of Toronto. This clinic represents yet another step forward. It's an important step forward, but it's yet another step forward in what we're now doing to take vaccines to the people. We've always done that, but originally it was more sensible for us to have a smaller number of larger vaccination clinics, and people rushed to make appointments. You might remember those early days when people were struggling to make an appointment because everybody wanted to get vaccinated, and that allowed us to get off to a great start and to really start to post numbers that were very competitive with any major city in the world. And we've still done that. But what happens, of course, over time, as you go through a campaign like this, is you have to shift your strategy, and we've now shifted to something that's much more local, much more targeted to places where there is a lower level of vaccination and where there's a higher risk of people getting infected with COVID-19. So here we are at the Woodbine Mall, and it's a place that many people in Toronto are familiar with. I know I used to bring our kids here early on because it was the only mall in the city that had some rides inside and as well as the store, so you could do your shopping and amuse the kids at the same time. And so what it is a place that people know. It's a place they can get to, and it's a place that they visit quite often. And those are all things that are prerequisites to what we're doing nowadays to make it as easy as we can for people to get vaccinated. And it just shows you what can happen when we work together. In this case, it's the City of Toronto, the Public Health, Toronto Public Health, the Hudson's Bay Company have all worked together to make sure that we can help more people get vaccinated. And we are, I can tell you right now, as a city, starting with me as the mayor and going all the way through the entire team, we are laser focused on getting to the 90% target that has been set as one that will really allow us to be more confident that we have taken this COVID-19 to where it needs to go, which is out of our lives. We know right now that the vast majority of Torontonians are already vaccinated, so the progress that we need to make are with people who are not yet vaccinated. So I want to thank the Hudson's Bay Company again for making this space available. There's still a store here, so you can come, and that's, I think, why we're talking about this as Vax and Shop, or Shop and Vax, so that people can do both. And again, that may be an inducement for people to come and get vaccinated. They've also, in order to make that a really attractive proposition, and listen up here, because this is not something that's happening all over the place every day, they're offering a 20% discount on in-store purchases to individuals who receive a COVID-19 vaccine at this location today as part of the official opening. So I'm expecting there's going to be a big rush out here today, Tuesday afternoon, for people who can come out and get a 20% discount. Think about the savings you could achieve on that, and also protect your health and the health of all of your family members and coworkers at the same time. The Woodbine Mall Clinic will offer walk-in COVID-19 vaccine service and student immunization. Some of the vaccination programs that happen for students all the time will both be offered here. And we also are going to be continuing to offer clinics at the Cloverdale Mall, the Stockyards, Mobile Clinic, the Village Recurring Mobile Clinic, and many more Team Toronto clinics that are operating in the city's West End to make sure that we bring vaccines to those who need them. All told, there are 28 mobile clinics operating today in the City of Toronto, along with the 5 immunization clinics, of which this is now one. This replaces, as you probably heard in the news, the hangar that did such great service in the central West End of the city. We also have, for this week, 141 mobile clinics, some of them in the same places over and over again, some of them in different places, as we move to target street by street, building by building, community by community, place by place, so that we can make it easy for people to get vaccinated. So, I mean, the good news is, as I mentioned, that millions have already been vaccinated. And what that represents in terms of percentage of the eligible population is 80% of eligible population 12 plus have received both of their doses, and just under 85% of eligible residents have received their first dose. So that we now have to continue to work at getting people with their second dose and getting others who haven't been vaccinated at all to come forward and get vaccinated. And I'm pleased to tell you that this past weekend, when we had the days of action, many of the people were having their first dose. But we know there's much more work to be done, and we're quite prepared to do that work, the whole team that is assembled here at Woodbine Mall and elsewhere across the city. On the days of action last weekend, 7,600 COVID-19 vaccine doses were administered during a 4-day period at 92 clinics, and they were located at every place we could think of. They were in parks. I visited one that was in a park, and people came by right along the sidewalk to get vaccinated. They were in subway stations. They were in malls and places like that. The clinic locations were selected deliberately and based on data collected by Team Toronto to continue to remove barriers, but also to bring vaccines to places where there is a lower level of vaccination, first or second dose, and where there is a higher risk of contracting COVID-19. They were easy places to get to, including walking by on the sidewalk, and that is so important as we push and continue to push to get people vaccinated. So I am proud to see us building on that success, and I'm going to today also announce a new blitz that we'll be having this weekend featuring malls. We will have Shop and Vax on September 25th and 26th, and allow residents to get their vaccine at all of the Eaton Centre, the Fairview Mall, Sherway Gardens, the Yorkdale Mall, and the shops at Don Mills from noon until 5 p.m. on those 2 days this coming weekend. And I want to thank Cadillac Fairview and Oxford Properties for, again, coming forward to be partners with us on putting these clinics on and making the space available for us to do it. I think this is a huge service. If you think about how full those parking lots are on weekends of people visiting those malls, we just hope that a number of the people who are not yet vaccinated or haven't yet had a second dose will shop and will get vaccinated at the same time. We really are bringing the vaccines to the people. So while people are out doing errands this weekend and filling up those parking lots as they do seemingly weekend in and weekend out, they can get their vaccine, help us to achieve our goal of 90%. But it's not about a number. It's about people being healthy, people being protected, people protecting each other, and making sure more so than anything else, that we can keep the schools open, keep the kids in school, keep businesses, restaurants, and other kinds of shops open, and that is best accomplished by getting people vaccinated. So please, again, I'll just repeat in conclusion, my plea to you to get vaccinated, whether it's a first or a second dose or both. You can't have them right at the same time, but you can get started. Please use the 5 city-run vaccination clinics that we have going. Please think about going to one of the malls that we have going this weekend, or one of these dozens and dozens of clinics that we will have over the course of this week on a mobile basis. The data has clearly shown over and over again in many different ways, but one of them I'll mention is this: unvaccinated individuals are 7 times more likely to become infected with COVID-19. And Dr. Davila shared some data with us this morning, and she may well again, that indicated that the people who are in ICU today are much more likely to be people who are unvaccinated. And I think that's all the evidence normally that we would need to understand how effective these vaccines are and how they protect you, but they also protect everybody else at the same time. And the fact is the Delta variant and COVID-19 are still with us. As much as we're fighting hard to get rid of it, they're still here. And so the time to get vaccinated and to protect yourself is now. And on that note, I would like to introduce to you, or reintroduce, because she's someone that's become very well known through all of her own hard work, leading this great team of Toronto Public Health people through the pandemic, the 500, I think it's 554 days and counting, Dr. Eileen Davila.
Thank you, Mayor Tory, and good afternoon, everyone. I'm truly very, very pleased to see this new vaccine clinic location opening to provide vaccinations to people in Toronto. It's well situated, it's accessible, and it's ready to welcome you if you have yet to be fully vaccinated. Ready and waiting if you're amongst those yet to join the more than 2 million Torontonians who have peace of mind as a result of being vaccinated. I want to focus on what I think is some good news today with regard to schools. Most schools have now been back for about a week, and I'm delighted to say that I've heard a great deal of positive feedback and enthusiasm from parents and students alike. I have always been an advocate for learning in the classroom setting. The benefits to young people are immeasurable. And I'm heartened to hear that the return to class is improving learning and improving moods. There was also some good news in the last couple of days that impact children between the ages of 5 and 11. Early findings indicate that one of the mRNA vaccines produces a good immune response in children in that 5 to 11-year age range. The full data are still to come, and an application has yet to be made by the vaccine producer to Health Canada to complete its review before making an approval. The other vaccines will likely produce similar news in the not too distant future. This is all good news by any measure, and we should wait with interest and optimism that soon we will be able to make it even harder for COVID-19 to spread. Because the harder it is for COVID-19 to spread, the easier it will be for all of us to live more normally, with less risk and fear, and more freedom to enjoy life. Until that day, vaccinated Torontonians are what we need. We are our best answer and our best defense. Vaccinating as many of us who are eligible for vaccine is the best way to protect those 5 to 11-year-olds waiting on that approval. And what is good for those children is good for all of us. So whether you come here or you find a mobile clinic or go to a pharmacy or your doctor, let's roll up those remaining sleeves here in Toronto and make the city as COVID protected as it can be. So with that, I'll thank you for your attention, and with pleasure and with gratitude, I will introduce Mr. Wayne Drummond, President of Hudson's Bay.
Well, good afternoon, everyone, and welcome. And I would first like to start by saying thank you to Tory Mayor, to Dr. Davila, to Councillor Ford, to Chief Peg, and to all of our frontline workers who are here today. You know, who knew that we would be here in this pandemic 2 years later? And as we are in the fourth wave, it's critical that governments and businesses come together and work closely together to provide safe spaces, to make vaccines available, and quite frankly, to keep each other as Canadians safe. Not only are we proud today to support Toronto's COVID-19 vaccination efforts, but also very pleased to support students through Toronto, through Toronto's public health school immunization program. As Canada's oldest retailer, we hold great responsibility to support our fellow Canadians. Hudson's Bay is a purpose-driven retailer, and we are fully committed to the well-being of our customers, our associates, and all of our communities. And so here again, we're excited and thrilled today to be able to partner and be part of this great vaccination work that Toronto is doing to protect Torontoians. And as Mayor Tory already promoted, I'll just say again that for every one who will come out and be vaccinated and do their part in getting vaccinated, we're thrilled to be able to give you a little sticker that'll say vaccinated at Hudson's Bay, and that'll make you eligible for a 20% discount throughout our store. And that's also proudly and honorably going to be made available to all of our frontline workers who are here and doing their part. So thank you, and thank you to the City of Toronto and to Toronto Public Health and to all of our great team at Hudson's Bay and to everyone involved in bringing this great clinic to life. Mayor Tory, I'll bring you back to the stage.
Just while we get organized with the questions, can I repeat that just so you know? If you come out here today and get your vaccination, you can have a 20% discount in the store that's right here. It's right steps away from the vaccination clinic because it's actually carved out of the store. So I think that sounds like a pretty good deal, and hopefully people in the northwest of the city or anywhere else that haven't been vaccinated will show up, and including if they're eligible to get their second dose. So please think about that for a minute and take advantage of that opportunity. Okay, questions?
Thank you, Mayor Tory. We will now open up the line to questions from the media. As a reminder, it's one question, one follow-up. We will unmute you when it's your turn. First up, we have Adrian from Global. Go ahead, Adrian.
Hi, this is Adrian Gobriel from City News. A question for Mayor Tory. When it comes to the vaccine certificates, tomorrow they'll be rolled out province-wide as well as obviously city-wide. How important do you believe the vaccine certificates are when it comes to keeping schools and businesses open in the months ahead?
I don't think the province would have come forward, and I commend them for the fact they did, with the vaccine proof, passports, had it not been something they thought was in the best interest of keeping schools open, keeping the very same businesses open, and protecting each other from the spread of the virus. And this is just one more tool, but I think it's going to be an important and effective one. I believe that the use of it and the enforcement of it will work fine if people decide that they're going to behave in a manner that is consistent with us all looking out for the collective good, whatever our views might be about vaccines or proof of vaccine or any of those kinds of things. I think if we all adopt a mind that says we're going to place the city and our neighbors and fellow residents first, everybody's health first, then there'll be very few incidents involved, and I know that businesses will be able to make the adjustments necessary to have that quick check of somebody's phone or a piece of paper. So I think they're going to be important, and I think it will go relatively smoothly, but that's going to just depend on people deciding that they're going to cooperate in the public good and that the time for these kinds of confrontational episodes or debates is over. It's time to focus on health, getting healthy, and getting the city back to normal, and getting people back to work and keeping kids in school.
And a follow-up question for Mayor Tory, and maybe Dr. Davila wants to chime in as well. How are you planning to track whether or not vaccine certificates are working as a public health measure to reduce spread, to keep businesses open? Some bioethicists believe we may never know how well they work, if they work at all. And this might be one massive social science experiment that could have lasting impacts on the social fabric of our societies.
Well, whether it's social science or medical science, I'm not in a position to really offer an expert opinion in that regard, and Dr. Davila may well wish to comment. But we obviously are watching every single day all of the different trend lines, case counts, infections, people ending up in hospital, who it is, matching that against the vaccination. And you've heard some of the very powerful evidence that says that you are much less likely to get infected if you are vaccinated. So our focus isn't so much on anything other than just getting people vaccinated and doing everything possible to encourage that, and then keeping everybody safe at the same time. And, you know, the use of these, both the asking for it on the part of proprietors of businesses and restaurants and venues, and the willingness to show the proof of vaccination is dependent upon the honor system largely, because, you know, whatever our wishes might be, we don't have, you know, anywhere near enough enforcement people to be at every store, every restaurant, every venue, nor would that be anything that I think people would really welcome. And so I just hope that people come to the conclusion, if they haven't already, which I think most have, that this is the best defense we have against any further lockdowns. It's the best defense we have to keep people in school, keep people working. It's the best defense we have against a terrible health menace. And that as a result, they will both ask for and will happily show without interference this proof of vaccination, because it's in everybody's interest this be done, including the people that are asking and the people who are being asked. And I think it's going to happen smoothly with very few incidents, because I think people are at that stage where that's what they want to happen. They want this over with. I want this over with. The doctor wants this over with. And on that note, I will call her to offer her thoughts.
Thank you, Mr. Mayor. I think the mayor has actually touched on a number of the key points. Perhaps the only thing I could add further is that we are dealing with a virus that was still unbeknownst to us as recently as 2 years ago. And I know we've heard comments today that it has been a long, almost 2 years of response. But in the grand scheme of things and in the scientific realm, 2 years is relatively short. So I think there are a lot of different things, measures that are being put into place, premised on the evidence as we understand it in our experience. And it is common medical practice, and I would hazard probably social science as well, to implement measures and evaluate and adjust in accordance with what you see. That's just good medical practice, and I think it makes good sense. What we've seen so far is that when there are vaccine verification methods put into place, we've seen this in other jurisdictions the world over, it does raise vaccine coverage and vaccine uptake, and we know that vaccines are safe, effective, and a key tool for us to get back to life in the way we used to know it before there was such a thing as COVID-19.
Thank you, Adrian. Next up, we have David Ryder from the Star. Go ahead.
Hi there. For Mayor Tory, following on one of my colleagues' questions there about the vaccine mandate, I'm hoping you can spell out for us exactly what city bylaw enforcement and Toronto Police, what their role in it is. When are they going to be called into action? And what are they going to do if somebody is refusing to show a certificate or trying to jump a line or otherwise trying not to follow the rules?
I'm actually not in a position to answer that question, because I would not want to answer it, you know, inaccurately. I don't know whether Chief Peg, are you okay? Well, Chief Peg can come forward and do that.
Hi, David, and thanks for the question. So, as you know, throughout our response to COVID-19, our coordinated enforcement team, which of course includes our municipal law enforcement officers, our Toronto Public Health Inspectors, and Toronto Police, have been connected in a collaborative manner and really stand at the ready, both responding and deploying proactively, and of course being available to respond to complaints. These are another set of challenging regulations for us to enforce, as has been the case throughout the COVID-19 pandemic and situation. So I do expect that our enforcement will largely be I would say, complaint-based. The Mayor Tory said it very well, that really our success in this moving forward is going to be largely based and dependent upon our collective cooperation. I have every reason to believe that our city will do just that. That's what we've seen the overwhelming majority of people have throughout COVID-19. Our coordinated enforcement teams stand at the ready. We are prepared, as we have been throughout, to respond to complaints, and every single case will continue to be evaluated on its merits. The process doesn't really change. The enforcement officers will arrive as deployed. They will under their own authorities take an assessment of what the situation is and will move forward with enforcement action only when that's required. So I would say expect to see largely complaint-based. We will continue to deploy proactively for a myriad of inspection processes and being active in the community from a positive public health perspective.
Thank you. My follow-up question is for Mayor Tory. A few minutes ago, my colleague Ben Spur tweeted, TTC has extended the deadline for employees to disclose their vaccination status to September 30th. Original deadline was yesterday, but as of today, fewer than 50% of workers have confirmed their status. I'm hoping you can comment on the need to extend that of not many workers coming forward, and if that impacts the city staff timelines and deadlines as well.
No, it does not affect the city staff timelines because they have already been extended and met with considerable success. And we still have a little bit of work to do in that regard, but I'm pleased to say that, the vast majority of city employees have declared their status, and the vast majority of those have indicated that they're, in most cases, double vaccinated, and in a very few cases, single vaccinated, and on their way, I assume, to getting double vaccinated. One of the things we discovered in dealing with the city employees was that those who worked in a kind of dispersed setting, where they were off working out of yards that were sometimes remote and even working away from those yards and places of city business, were sometimes harder for us to reach. They weren't people that necessarily were sitting at a computer or even looking at email over the course of the day. And if you think about the work being done by transit operators and others in the transit system, they work in that similar kind of way. And so I think it's understandable that there's a little bit of extra time needed to try and get that number up to levels that obviously we would all prefer. And my understanding is that everybody's working together now to try and make that happen. I think it is a very fair request. And it's made in extraordinary circumstances. And normally with something kind of medical like this, you wouldn't be making this inquiry. But we've consciously decided as a city, the TTC has, the police service has, that we need to know who is vaccinated and who isn't. And then we need to try to work on people who aren't, to persuade them and reassure them and comfort them and inform them, because we need to get as many people vaccinated as possible, especially in instances where those are people that are interacting with the public very directly. And that's for the safety of themselves as operators and for the safety of the public as well. And so I'm optimistic that as that time is taken between now and the 30th of September, those numbers will come up and we will be able to continue to move forward and reassure the public that we're both setting an example, but also that we're doing everything we can to protect the health of our employees, which is a very important responsibility we have, but also to protect the health of the public.
Thank you, David. And next up, we have Michael Smee from CBC. Go ahead.
Hi, Mayor Tory. Just a quick question about an issue that you'll be discussing at Executive Committee on Thursday. It has to do with basically the effects that COVID has had on the 2021 operating budget. It looks like you're facing a shortfall of $93.7 million, and I'm wondering how might the city cope with that in terms of cutting services? And as a follow-up, how seriously would you be considering a property tax hike to make up for that shortfall?
Well, first of all, we have no plans to cut services. This is a time during a pandemic when people need the services the city has to offer and has offered to and continued to provide throughout the pandemic. And I credit, it's Public Service Week, and I want to credit our public service team for the magnificent job that they have done maintaining those services throughout the pandemic. With respect to the question of a tax hike, I am committed to a tax increase not larger than the rate of inflation, and that was a commitment that was made that didn't contemplate a pandemic, obviously, but it won't be affected by a pandemic because we will continue to strive to achieve that, and that is as a result of an extensive budget process that hasn't yet formally begun, although I've been engaged in meetings about next year's budget since, I think, April. So we're working on it, but I don't foresee, again, that kind of a tax increase that you talked about as being something that is applicable at all now because of the fact that so many people have struggled with the effects of the pandemic. What we will do is two things. First, we will continue what have been heroic efforts made by our public servants again in constraining expenditures. $500 million each of the 2 years they have managed to do through achieving efficiencies and different things that we've done so as to reduce the size and scale of the financial shortfall caused largely by reduced transit ridership. The vast bulk of the shortfall we had, which was not 91 million, but it was in the billions of dollars, was occasioned by the fact that transit ridership dropped off so much during the pandemic. And the second thing we will do is we will be able to begin our work immediately, thanks to the fact, and I say thanks to the fact, that the fact is that the same government will be there that we've been dealing with throughout. And when you saw the letter that I wrote to the national party leaders during the course of the election campaign, the number one issue that was listed in those letters, among 4 or 5, was the need for us to finish the job with respect to financial shortfalls caused by the pandemic, the money that you've made reference to, and then to look ahead to 2022, where as much as we're working hard to get transit ridership back up and get people back to work, we don't expect ridership levels to get back up to pre-pandemic levels and therefore produce the revenue we need to operate the system completely as we're doing until well into that year. And so we will need some money to help us with that, and that was something we were hard at work on with both the federal and provincial governments before the election, and now we'll get back at it. I should add this, I'm very optimistic about that, and I'll tell you why. First of all, those two governments have been there for us in the City of Toronto, our transit needs and other needs over the course of the pandemic. They have been good partners. And secondly, with respect to the re-elected government in Ottawa, they are a government that gets cities. They get the fact that a big city like Toronto cannot operate on some kind of a transit system that is, cut in half because of the fact that ridership has slowed down. They know we have to keep operating the whole system to get essential workers to work, to accommodate the fact that we want people to get back to work in the downtown and other parts of the city, and that it is the lifeblood of operating a successful city that represents a huge part of the national economy. And so the government that gets cities is the government we're going to continue to deal with, and I'm very optimistic that we can continue to succeed with them and the province to find the help we need to make sure that we can stay on a sound financial footing. And I'll mention one more thing in that regard. I said the other one was the last one. We had our credit rating unusually reviewed during the course of the pandemic. And the report that was written said that not only was our credit rating maintained at a high level relative to other municipal governments in the country, and we are by far the largest municipality in the country, but that they credited the fact that we were managed soundly, and I don't remember their exact words, but they credited us for sound financial management. That will continue as well, and that all of that will say to people, as I do, they don't have to worry about that report written as of June 30th. We're working on it. We will get that problem resolved, and the city's finances will remain sound, services will remain in place, and the tax hike, without presuming upon the budget process, will, if I have anything to do with it, not be above the rate of inflation as committed.
Thank you.
A follow-up question? Mike?
No, I'm good, thanks.
Okay.
That's it.
Thank you. That's it for today, everybody. Thank you and have a great rest of your week.
Thank you. And remember, 20% off in this store today if you come out and get back.